Hi everyone, I'm Karen Jimeno. We're here in Makati City at the VictoryART laboratories to talk to Dr. Gia about their clinic. They're specialists in IVF and fertility. But more specifically, we're going to talk about egg freezing. We're going to find out how this procedure allows women to embrace their ultimate calling, motherhood, but at their own and right time. Hi, Dr. Gia.
Hi,
Thanks for
Karen.
inviting us here.
So welcome to have you here, Karen.
Dr. Gia, to start off, can you tell us what egg cryopreservation or egg freezing is?
Yes, egg cryopreservation is better known as egg freezing. So it's a 2-week procedure wherein a patient receives injections for 10 to 12 days. What this does is it causes the ovary to produce several follicles. And when the follicles reach a good size, they undergo a procedure called egg harvest, and then they collect the eggs and then they freeze them. So when the patient is ready to use them, they just thaw the eggs that are frozen.
In the first place, why should a woman freeze her eggs?
There are many reasons why a woman would want to freeze her eggs. One is maybe the woman is very busy, so she's focused on her career, doesn't really have time to start a family yet. Or maybe she hasn't found Mr. Right yet. She isn't in a long-term relationship and she wants to preserve her reproductive potential. It could also be a medical reason that maybe premature ovarian failure runs in her family and she wants to preserve her eggs then.
So when is a good time for a person to freeze their eggs?
Usually we do it when the patient is in their late 20s or early 30s. But we also have patients who come in their 40s that preserve their eggs also.
You mentioned earlier hormone injections. During the 10 to 12 days of hormone injections, does a person have to go on leave from work or whatever, school?
A common misconception about this form of treatment is that it takes you time off from your life, from your work. But in fact, you just go to the clinic. It's a 5-10 minute procedure. They do an ultrasound to monitor your progress, give you your shot, and then you're free to go.
And why does a person have to go to VictoryART laboratories to get the injections? Can they just do it themselves?
This is actually a personal preference of ours. We'd rather administer their injections because we want to make sure that the patient is receiving the correct dosage.
Well, for those who are afraid of needles, do the hormone injections hurt?
Well, it's just like any other normal injection. So there's a stinging pain when the injection is given, but then it will soon go away after 5 to 10 minutes.
I heard some women feel more emotional during the hormonal shots. Is that true?
Actually, a lot of patients ask about this. But since you are receiving hormones in the treatment, sometimes you can experience those side effects. But just like taking pills, say for example, some women experience breast tenderness, some experience headache or abdominal pains. This is just the same. Some people experience those symptoms like moodiness, but others don't at all.
During the extraction process of the eggs, does that procedure hurt the patient?
No, it doesn't, because we actually put them to sleep. So the patient is under general anesthesia. She undergoes a short outpatient procedure, roughly around 30 minutes, and then she wakes up and then she can go home already in the same day.
I heard other clinics who also offer egg freezing inject less. Why is that?
In Victory, we use conventional IVF, meaning our goal is to produce the most number of eggs for egg freezing. That's why we give a higher dosage of medications.
After a patient undergoes the egg extraction process, can she run or walk after or do other types of activities?
After the procedure, the patient is allowed to go home already in the same day. But of course, she can't undergo strenuous activities. We still advise the patient to have some rest. But of course, she can still walk, she can go shopping.
Okay, good to know. Eat out after. Dr. Gia, let's go to the question of cost. How much does it cost to undergo an egg freezing procedure?
The cost depends on the age of the patient. Of course, when a woman ages, the ovary isn't as active as it used to be when she is younger. So you would expect to incur a greater cost. But at the age of 30 or late 20s, you would expect to spend in the ballpark of 300,000.
So it's really advisable to start early, like
Yes.
20s, 30s. And once you have the eggs, how much does it cost to store the eggs?
So the storage costs around 10,000 a year.
What's the advantage of VictoryART laboratories over other clinics?
Our advantage is we are one of the pioneers of IVF in the country. And That means that we have years and years of experience behind us. Also, VictoryART has one of the highest pregnancy rates in the country today.
Wow, that's really impressive. Thank you again, Dr. Gia, for this interview. I'm sure you've helped a lot of women out there, including me, have more confidence in the egg freezing procedure. And I'm really glad that there's this service now that allows women to unlock their potential for motherhood, but at their own and right time. I now have a new hashtag, #OwnTime. At least us women don't have to run against the biological clock anymore. Thank you again, Dr. Gia.
Thank you, Karen. And for those who are interested, visit our website or leave a comment below.